I'm a physician assistant and I work for a family medicine group and have done so for about 20 years. So I've really treated many patients over the years that struggled with obesity and other weight issues. So I felt really compelled myself to investigate options for them. And then I also struggled with my own weight issues. When I started looking into the surgical options, I realized that I struggled with a lot of the same issues that my patients did. I'd had some success at losing weight on my own. My problem, as were many of my patients, I could not keep it off. I had stopped doing a lot of the things that I really enjoyed. For instance, I used to hike, I used to run. Not that I was ever particularly athletic, but I enjoyed being outside and I enjoyed nature. In addition, just regular things in life, such as getting up and down off of the couch, bending over in the car to try to reach something that fell on the floor, or flying in a plane and seeing somebody coming down the aisle towards you with a look on their face that clearly says, gosh, I hope I don't have to sit next to that fat person. So I began looking into the different procedures that were available and different surgeons around the area, and I was very impressed with the Allegheny Health Network Bariatric program. When I considered the times in the past that I'd been successful losing weight, I began to realize that the biggest thing was portion control. And for me, keeping the weight off was difficult because even though I was eating less, I was still always hungry. And so even after a period of time when I'd lost a significant amount of weight, to try to keep that weight off just was a daily struggle. They really prepare you for what you're going to undergo. You have no doubts what the procedure is going to involve. Every step of the way, you're informed about what's going to happen. But most importantly, you are educated about what you're going to need to do post-surgery. I expected to feel deprived after this procedure, and I found that I haven't, that I still can have enough variety in my diet, but I don't have to eat as much. And so I feel like I'm never feeling like I'm deprived of anything. So prior to the surgery, I was really limited in my activities, and one of the things that I really enjoyed doing is I have pet chickens. The problem is I could take care of them, but I really couldn't enjoy them. I couldn't run around the yard after them. I couldn't get down on the ground and play with them because, believe it or not, they are quite playful. So that was one of my goals, was to be able to chase the chickens around the yard, get down on the ground, hold them and play with them. And now I'm finally able to do that. Since I've had the surgery, is that I'm living again. And I feel like not only do I physically feel 20 years younger, but I feel like my mind is happier. I'm doing the things that I really enjoy and doing them without great difficulty. I think one of the things that makes the Allegheny Health Network Bariatric program different is the amount of support that patients get, both pre-op and post-op. Additionally, I never felt like a number. I didn't feel like just any patient. I felt like everybody, even though it's something they do every day, they realized that I didn't undergo surgery every day, and they made me feel like they focused on me and meeting my needs and taking care of me.